I'm so happy that I have come up because a lot of people were requesting me to make a simple video on how to write discussions, how to write introductions, what is the concept in writing for these articles. Now, you can use the same technique in writing narrative reviews, the whole narrative review, the case reports, introduction and discussion, because the case report per se should come from the patient's details. And you can also write discussions for your original article, systematic review, the introductions for the same. So they all will come around writing in a similar concept that we're going to discuss today. So first, let's just take narrative review. Narrative review as our mode of understanding. So narrative review usually will have an introduction where we will talk about our topic, and it follows with the next heading, that's the discussion part. So these two are the points for us. And now if I have many subtopics, let it be under discussion. 2.1, 2.2, 2. Infinite. You can go ahead. The bigger your discussion, the more vast it is, and the more clarity in the way you represent the data, the more the acceptance rate in bigger journals. It's all about how much you have accumulated and how easy it is for readers to understand, because your study will be sent for reviewing. And those who are expert in these fields of, for example, we will do a review on, let's just say, isoniazid and Rett syndrome, isoniazid and Rett syndrome. I want to do a review. So it is rare, and we can do a review on it. So the experts in isoniazid medications, it can be from the Department of Pharmacology or Department of Respiratory Medicine or any pulmonologist. So they will go through, and it should be easy for them to understand. And if they see some new remarkable points, which is not there in the standard textbook, your article is a definite yes for them. So always try to explore something beyond. Something even it is a new finding and there's a lot to go ahead with. You can add those points and cite them. So how to start our journey of collecting the data? So first thing, I request all of you to go to Google Scholars. You can also go to PubMed and log in PubMed, and let's see how many similar articles are there. So Rett syndrome and what do we have? Isoniazid, right? Isoniazid. So let's see what comes up. So a lot of studies come in, and see, you can see this graph. You can change the years and see in the left corner, right? The one over here. Okay. And I can see there are a lot of studies from the recent years. So let's filter. Let's filter it. Mm, mm, mm. 2017 to 2024, right? How many studies are there in total? This page one of two. Okay, so it's pretty less, especially in the recent 5 years. So let's see. There are so many studies. There's a patch testing and drug reactions by some authors. It's a literature review. Okay, then there's tuberculosis. There's a lot of interest. Now you can read anything. Case reports. Is it an original article review? You can take points from a review and put in your own review as well. So that's totally fine, but it's not be plagiarized. Plagiarism should be prevented. So take some points or going to a literature review, find the source, read that, and you'll find a lot of points each literature review could have missed in your perspective and add those points. So that is the whole trick behind it. I'm going to take this case report. I'm taking this case report because I'm the author of it. So it would be more easy for me to show how to write by taking a sample study. Now, see, there's a lot. See, this is a case report. I have an abstract. You will have keywords. You will have introduction, and you can divide into however you want. Case presentation, you can see there's a picture. This picture I can type, right? I can just type into paragraphs, but it makes it more presentable. So A, B, C, D, E. So what are the findings? Then the findings of the case report pictures. Then there are some other figures as well, ECGs, and it goes on and on. And finally the discussion part. So discussion part, and so conclusion. So I'm going to take this study and I'm going to show you because I've read this study very well, so I don't have to read it, but you have to first select few studies, you need to read them, understand them, and choose points from them. So the best way to read is read the abstract. See here, they're saying this life-threatening situation, and my patient is 20-year-old patient on so and so drugs, HRCD regime, and finally they found that the syndrome is caused, and they removed the offending agent. So I have to now look who was the offending agent. So let's go to the case presentation and see who is the offending agent. Now mostly it will be somewhere in the end. I just yeah, for the examination. See, now they could have done some kind of test, I'm sure, to find the cause for this Tourette syndrome. So you have to look in the medication. See, patch test confirmed rifampin and isoniazid as the culprit medication. So that is the answer. Patch test has confirmed rifampin and isoniazid as the medication. So now I'm going to you choose this patch test. Okay, so rifampin isoniazid has caused this particular reaction. So let's begin. Now I'm going to take one particular paragraph and I'm going to show how to write it. So let's just take, for example, this paragraph right here. Okay, I'm going to take this paragraph and I'm going to show you how to write it. So writing is not paraphrasing, it's just you understand the whole sequence and write in your own words. And I will be typing, but it's just an example. So I like these points in these paragraphs. So how am I going to write? An observed correlation exists between the presence of HHV6 in patients suffering with Tourette syndrome, indicated by test revealing IgG against HHV and identification of genetic material along along the viruses like Epstein-Barr virus, cytomegalovirus, and HHV. Hypothesis suggests that viral activation is directly caused by TRS, so culprit drug and subsequent viral reactivation led to cytokine storm. So, if I have to write this in my article, I like this sentence. I have chosen this sentence to be written. How will I write it? So it's simple. See, they found an HHV6 and Rett syndrome correlation. And what is the test of proof? IgG acting against HHV and also other viruses like Epstein-Barr virus, cytomegalovirus, and HHV are also there's correlation with Rett syndrome. So what will I say? I can write correlation. Okay, so with uh, correlation with various viruses such as HHV6, Epstein-Barr virus, cytomegalovirus, and HHV7 is seen with the syndrome. Now, maybe there may be a grammatical error. Do not worry about that. You can correct it with so many online tools, a grammatical error. But first frame it. Frame the concept behind it. Then we can fix the grammatical error and we can go ahead with a lot of other fixings. Because there's so many things to fix. It's not the grammatical error. Maybe the whole sentence must be written in a paraphrase way to make it more pleasing. So don't paraphrase if you have to the just direct study. Okay, don't paraphrase this word. Paraphrasing this word, they have very good tools which will tell you how exactly paraphrased it. So choose. See, correlation various virus. This is seen, and I am not going to add this, or maybe I can add it. If I have to add it, then how will I write? So I have to continue writing saying that the test, okay, as mentioned in Raymond et al. Studies, Raymond et al. That IgG acting against HHV, and which is used for identifying the genetic material. However, it is. So once you write this statement, always credit the author, right? So before your full stop, add a bracket, and for example, I'm going to put this study. I'm going to put this study as the reference. So I'm going to write reference. My reference one is this study. Now, how to go and find the reference? Oh, that's easy. So go to your study. Most of your studies will have references. Click cite and copy this, okay, and then go paste it right here. So yeah, so this is my reference. So I know the reference looks quite big. Uh, so just a minute, let me just. So it will be much easy to do in Word, but I'm just this is completely for illustration purpose. So you will just go and keep your reference. So this reference one is these guys. Okay. Now, for example, I like some other sentence. See, I like this sentence because it makes sense. See, I'm writing about isonacid, right? My topic was about isonacid, so stick to isonacid topic. Okay, so look for topics correlating with isonacid. See, TB medications, so and so, 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 are all related to Rett syndrome, but rifampin has the highest frequency. So say that uh, for IgG acting against HHV, uh, or you can remove the sentence because you try to write something more significant. So instead of this, I can say that case report case reported by Raymond et al. Raymond et al. Uh, stated that rifampin and isonacid, okay, have caused Rett syndrome, Rett syndrome in their patients, which was confirmed with the pathology test. I think it's pathology. So how do I know this test? It's not there in this paragraph. It was there in the one before it, pathology test. So write it, okay, cite it. Okay, so for those who didn't understand what I've written, it's in the discussion part, which we have just read. That's it. See, no, the case report, they have mentioned that patch test has confirmed with isonacid. So you should write patch test. So patch test has confirmed with isonacid as per these people's studies. So just see, just go ahead with writing the findings. Use that discussion also. They'll have a lot to explain in the discussion. So let's see. There's talking here about registrar criteria. So I can pick that and I can talk about it. Registrar criteria. Okay. So we can talk about them as well. But I think I have other plans. I will choose some other paragraphs which is more interesting. Oh, see this paragraph. There's a lot. Okay, there's a lot in this paragraph. A lot of genetic stuff, right? So let's pick them and let's start writing them. So, so what can you say from this sentence? The definition of stress is used by Pocket, which is a severe cutaneous reaction with fever and systemic manifestation that endangers the patient's life. I don't think I can use it for my review, which is on isonacid, right? And the clinical presentations, we're telling clinical presentations. Then they're showing genetic variations. These genetic variations play a crucial role. triggering of immune system. So you can write it yourself. So drugs, see, because my topic, what I've selected to review, as I mentioned here, I'm talking about isoniazid, right? So make it into your topic. So drugs like isoniazid causes stress due to various mechanisms. And see genetic variations. They're saying about some genetic variations. Then they're talking about CD4 and CD8 involvement. Then they're saying genetic links are approached with certain drugs. See abacavir with HLA-B507, allopurinol B801 in Chinese ethnicity, which is linked to many other medications. So I have to go and see isoniazid. Is it linked to any HLA? Isoniazid causing drugs. Is it linked to any HLA? So go back to your what is it? Go back to Google Scholars. Isoniazid causing Druss syndrome, HLA. So see, antitubercular drug associated drugs with HLA CW04. So this case series is telling something unique. So we need to look into it. So population. Oh, this is actually closed access. Okay, so we cannot read them. But you got an idea. So actually CW401. So look for some similar studies. See, and both this particular study saying that cell clones can be generated for both isoniazid and rifampin in patients with actually C401. So let's open this, right? And so here you will find about some study, but this is also again closed. So there are ways to open these journals. You can find it out in the Google. But so I got an idea. I have to now further focus on HLA, HLA C401. So so that's how you should keep going ahead and seeing what is specific. So I find some HLA, then I should mention in my writings. Uh, so what is it? Where was it? So drugs like isoniazid cause various mechanisms, and isoniazid along with rifampicin, okay, is associated with whatever HLA, whatever we find over there, is associated with HLA this, as seen in whichever study, and copy it, name that study what we just saw now as reference to. So you should keep going ahead. So how to know what to write next? It's very simple. First, make a plan. Introduction. Okay. In introduction, what am I going to cover? So my topic is isoniazid and Rust, right? Isoniazid and Rust syndrome. So first thing is I can complete what is Rust syndrome. Okay, what is isoniazid has to do with Rust syndrome? What is the incidence per year? What is the what is the recurrence? What is the fatality rate? What is any associated with something else? Is it particular in any ethnicity? So you can go ahead with so many topics in introduction regarding the correlation between these two. If you're writing a case report, so go ahead with your case report. If you're writing a review, start the discussion part under the review itself. Because mostly there'll be two headings, introduction, review. So review. So under review, what can I say? So many things. So with this one case report, see, don't judge what to write by just looking in one case report or one literature review. Read at least 10 to 15 and you'll get an idea of what topics you should choose, subtopics, and go ahead with it. So reviews. So what can I do for this particular study? Isoniazid and Rust. I can talk about dress symptoms. Okay. Then what can I talk about? I can talk about isoniazid mechanisms, mechanisms which causes stress. I can talk about any HLA association who are susceptible for this reaction. I can talk about the treatment. Okay. The the prevalence of uh, this particular HLA in what and all ethnicity. See again, it's all how you read and you find out what are the points. I can talk about Regisca criteria, which is used to diagnose this. And is there, I can look for some studies which says that is there any difference between Regiscard scoring increased or decreased for isoniazid versus any other drugs? These are all hypotheses. Okay, you have to see whether it's feasible. Is there data regarding it, and go ahead. And as you keep reading, you'll find so many subtopics. Okay, what about the other drugs? What are their mechanisms? Please mention them. Don't stick to only isoniazid. Just give a small idea behind it. What is the mechanism? It's usually CD4 and CD8 cells. And you keep, so once you make these headings, okay, what all is possible? Under this heading, look for something relevant. Look for relevant articles in PubMed, relevant articles in Scopus, relevant articles in Google Scholars. Read them and write those sentences in your own words. And don't forget to cite them. And once you cite them, go to your reference and cite them. So that's the way to go ahead with your exploration in understanding a topic. See, when you do narrative review, people know that you have not done a research of humans by yourself, but you have read so many studies together and you have compiled the outcomes in your literature review. So, if, for example, if I really like to know about isoniazid and rifampin, I would like to first read two, three literature reviews, which is also called as narrative reviews. Get an idea, then go through some case reports, further get idea, then see if something I can find anything unique in some original articles or any randomized controlled trials on these susceptible people. What are the alternate medications given? Is there any association with those who have the syndrome with isoniazid, with any other any other etiologies? Is something is there anything else that helps in precipitating? So all these will come into place. But that these are the end thoughts. The first, you need to understand something, narrative review. Then understand the case, read case reports. Then from there you can go ahead with any topic. But if you already have a basic knowledge on that particular ailment, you can directly go and see similar narrative reviews, see what headings they have used. Some narrative reviews will have some very unique headings. And as the years pass, a lot of breakthrough happens. A lot of new concepts come around because genetics is working. Every day they find something new. So whatever you can correlate from genetic studies, epigenetics, please add them and cite them, and you're good to go. So that is all how to write a narrative review. If you have any doubts, please don't forget to comment your doubts. We'll get back to you. Okay, comment your doubts. Thank you so much for listening to the whole video. If you have any doubts, I will I will put few more videos as such so people can get more exposure and can understand how to do a narrative review independently. Thank you. Have a nice day.